Hey guys, once again, thanks for being here. Today I'm going to be, this is my third part of my series here, 6 most common injuries in the nursing profession. And I've talked about those common injuries 2 days ago. Yesterday I talked about how to prevent them. And if that didn't work, today I'm going to talk about what you do when you get injured. Hopefully you won't have that happen to you in your career, but it does happen. For those of you guys who don't know who I am, my name is Jason Rozinka. I've been a nurse for the past 20 years. And I've seen my fair share of injuries. I've been had little tweaks here and there of my own, and it happens. And it's it can be career-ending for some people. And hopefully this doesn't happen to you. But I'm going to explain a little bit more on what you can do if it does happen to you. Number one, really is honestly report all your injuries. It doesn't matter how small they are. You need to report them. They need to be taken care of right away. Because even if you just have a small injury that doesn't seem like much, it can escalate, it can get worse. If you've got a tweak in your back, you're going to be lifting patients a little bit differently, and that can lead to more injury, for example. Same thing with a knee or an ankle or a wrist or shoulder, anything else that's going to affect the way you move or lift people. Over time, those are going to get worse and worse. And if they're not reported right away, you're not going to get compensated the way you should if this happened on the job. So yeah, number two is to be aware of your hospital policy. And it's something we don't necessarily look at until we get injured. We don't really know what the policy is. So it's a good thing to be aware of and to research if that does happen to you. Number three is not to return to work until it's safe, until you can be safe. Don't try to push it coming back to work too early. If you need to go back on light duty, if you absolutely need to get back to work, they should be able to accommodate that. If not, they'll find something for you to do, hopefully. But don't go to work too early, and risk for re-injury is there. You don't want to do that. Even if you're not able to go back and do your job, which does happen, if you're in a heavy lifting type of job, like in the ICU with some big heavy patients, you might need to consider a different job, maybe in a clinic or something that you're not doing direct patient care, still within the nursing profession. Number four is be aware of how you got injured. Is it something that's maybe a breakdown in hospital policy, something that doesn't happen very often, if there's not a policy about it, regarding safety, regarding communicable diseases, violence, sharps, whatever it is. If it's a breakdown in the policy, something that needs to be changed or fixed. Maybe it was your fault. Did you screw up? If you did, it happens, and you need to learn from that, and hopefully it won't happen again. So, educate yourself and educate others about what happened to you and how it can happen to them. Maybe it's your health and fitness. Maybe you're out of shape. A lot of nurses are. Somewhere over 53 to 55% of nurses are obese, and that can lead to a lot of workplace injuries if you're not able to physically do your job. So that could be something that you could fix, something that you could work on. The last one I have is kind of like your ACLS algorithm, is to seek expert consultation. If it's something that escalates that far that you need to be compensated for something that happened to you at work, you may need to consider getting a lawyer to see if that's something that you can get compensated for days that you had off of work. So that's it for this series, guys. Hopefully this kind of helped you out, and hopefully you don't get to this part. But if you did like this video, like, comment, and share, and I'll see you at the next one. All right, guys? Peace. Remember to play hard and eat well.